In this hypothetical situation, Mr. John Doe is a 75-year-old male living in Talkeetna, Alaska. Talkeetna is a small town in rural Alaska. It's populated by less than 900 people. There are only 3 clinics, there's 2 senior care facilities, and there's no 24-hour emergency rooms. Mr. John Doe lives at an assisted care facility, one of the nicer ones, which cost him $6,000 a month just to receive their services. One night he had a sudden onset of rectal bleeding. Since there's no 24-hour emergency rooms, an on-call medic was called. If the situation is life-threatening, an air taxi can be called, and he can be transported to the nearest major hospital, which would be in Wasilla at Matsu Regional. That's about an hour away. The emergency care center at in Talkeetna is First Care Medical, and it's only open till 11 p.m. If the situation isn't life-threatening, the on-call doctor will stabilize the patient and refer him to a specialist. In this case, that specialist is in Anchorage, Alaska, which is 2.5 hours away. At the Sunshine Clinic, the major hospital in Talkeetna, they do offer a transit to Willow and Wasilla, but not to Anchorage. So any expenses to Anchorage, that domestic travel will all be on the patient. In Anchorage, there's only a limited pool of GI, gastroenterologists, who would be the specialist that would treat Mr. John Doe in this situation. Medicaid has preferred providers, and there's a facility at Providence Health Park called Alaska Digestive and Liver Disease that has 3 providers that are preferred by Medicaid, so he would have to be referred to one of those. Suppose after the consultation, the doctor finds that Mr. John Doe has hepatitis C. Now, while Medicaid does cover treatment, you have to fit certain criteria. The patient has to have chronic hep C, not acute, and they have to have a fibrosis level of 2 or higher. Let's say for drama's sake that Mr. John Doe is only a level 1, so his Medicaid won't cover the treatment. He'll have to wait until he's sick enough to get coverage. And this medication for hepatitis C costs anywhere from $50,000 to $150,000, which Mr. John Doe can't afford. This can be a potential challenge that he faces in this situation. While he's waiting until he's sick enough, his liver is getting worse. And while he's waiting to be sick enough to get treated for his hepatitis C, he can be having other problems, and he could be going through the same process of trying to get Medicaid to cover whatever he needs to be treated for his other issues. I think that in this situation, the medical system that surrounds Mr. John Doe has both positive and negative attributes. I think it's effective. I mean, he will get treatment for hepatitis C eventually. It's definitely patient-centered. I can say from experience working in this kind of situation, we present a patient with options, and they get to choose. We don't dictate what method or what path they go on. It's equitable. There's no discrimination by race or gender or anything like that. You just have to be sick enough. And this leads to the negative attributes. It's inefficient, it's untimely, and it's definitely unsafe. While we're waiting for the patient to be sick enough to receive treatment for it to be covered, we're exposing him to more risk factors, and he already has preceding issues, which is why he's living in an assisted care facility in the first place. Overall, I would say that it's definitely more negative than positive, just because in rural places, people don't have access to the kind of medical services that they need, especially in emergency situations, especially in an area where it's populated by older adults who are more susceptible to things, and they do need more help. And there's just not the staff to provide that care, because one, people don't want to live in those rural environments. So it would take a lot to get a specialist provider out there, or a bunch of specialist providers out there to make these kind of services accessible. Coverage is also a major thing. Only 30% of the population had health insurance, and this can be due to a lot of factors, but that's a risk factor to bad health in itself. These are my sources. Thank you for watching.